Hello everyone, welcome again to the part 2 of Disaster Relief Medicine. This is 8 things you need to know on disaster response. Response phase begins immediately after the impact. Among all phases of disaster, the response phase is usually the shortest phase. Why? It is because in this phase, the aim is to save as many lives as possible. Hence, the duration is depending on how long the survivors can survive without food and water. The agencies that involve in managing disaster are the police department, the fire brigade, the medical team, non-governmental organizations such as civil defense and St. John Ambulance, and sometimes, in certain cases, the army. The acronym for 8 principles of disaster response is COSCARD. It stands for Command and Control, Safety, Communication, Assessment, Decontamination, Triage, Treatment, and Transport. Number 1. Command and Control. The first step in disaster response is to establish command and control, also known as incident command system. It is the way to organize our team to combat disaster. In the incident command system, remember the acronym COPLA. You will have commander on top as the leader, and then operation, planner, logistic, and admin under the commander. The chain of command within an organization is vertical. Only the commander can give orders to operation, planner, logistic, and admin. The chain of command within an organization can never be horizontal. For example, operation can't give orders to planner. This is to avoid confusion caused by multiple conflicting orders. Horizontal chain of command can only happen across commanders of organization. For example, commander of police can give command to medical commander to do medical operation tasks. The police commander cannot bypass medical commander and instruct medical operation to do the task. Number 2. Safety. Safety is the most important principle in disaster response. It is always the safety to the team should come first. Self-safety and the team member safety is the most important, followed by scene and then survivor. Proper personal protection equipment should be worn when working in disaster situation. Pre-hospital care provider should not enter a red zone unless ordered to do so and are well protected. Number 3. In disaster, we never work alone. One of the most important things that we need to know is communication. Communication is the commonest point of failure noted during response. There are many options of communication devices such as phones, PA system, and GURN. Two-way radio is the most commonly used device in any emergency response. When communicating, message should be accurate, brief, and clear. Number 4. Condition changes during disaster. Therefore, continuous assessment should be done throughout the disaster. Assessment should be done continuously in order to determine appropriate response. Assessment should include the scene, for example, the severity of the situation, human resource to assess whether the team is exhausted, is there any need for food, or the need for reinforcement. Equipment and supply, is there any need for replenishment? Environment, to see the progress of the incident. Victims. Is there any need of special case? And lastly, the situation of operational team. How is the triage, treatment and transfer team doing? All of this need to be continuously assessed in cases of disaster. Number 5. In disaster, victims and rescuer might be contaminated with harmful substances. Therefore, we need to think of decontamination. Not all disasters need decontamination. The need should be assessed when deemed necessary. Dilution is the solution of pollution. Most of the time, decontamination can be done with water irrigation. Number 6. Disaster usually involve a lot of victims. Their need of care differs from one another. Therefore, we need to sort them out according to priority. In order to do this, we need to do triage. Triage comes from a French verb which means to sort. Triage is a process of classifying the patient according to urgency of received treatment. The principles of triage are to do most good to the most numbers of victims, to classify according to priority. And lastly, triage is a dynamic process and should be repeated in every stage. In field triage, we use START system, which stands for Simple Triage and Rapid Treatment. START algorithm consists of 3 components: RPM. R stands for respiration, P stands for perfusion, and M for mental status. This topic will be further discussed in third video. Number 7. Treatment. There are so many things to do in order to treat victims which we are not able to complete at the scene. The principle of treatment in a disaster situation at pre-hospital level is to aim for minimal acceptable care, MAC. Victims are treated so that they can survive the journey from pre-hospital to the hospital. The principles of treatment mostly directed towards airway, breathing, circulation and immobilization, A, B, C and I. Number 8. Transport. Finally, all victims of disaster need to be transferred to another level. Therefore, they need to be transported following the principles of transport, which is the right patient, the right place, at the right time, 3R. The priority of transport will go to number 1, the victims that have more severe or higher triage. Number 2, if the victims have the same level of severity, the priority will go to those who will benefit the most as a result of a transfer. We have now completed 8 principles of disaster response course card. Please continue to watch our third video, which will be focusing on triage. So, are you ready for the next disaster? Thank you for watching.